Monitoring, evaluation, accountability and learning have been identified to be critical metrics of assessing the overall performance of organizations such as NGOs and governmental bodies. Additionally, it helps in evaluating whether a project is achieving its targets and understand the required needs and adjustments. As organizations aim at pursuing successful projects, the demand for its skills has gone up. This program by Humanitarian Global is an introductory course to the MEAL field that seeks to enlighten upcoming MEAL professionals on essential project management skills. Among the covered modules and topics include Introduction to MEAL. The learner will get to learn more about the history of MEAL, what is MEAL, MEAL phases, and the significance of MEAL. In the second module, which is MEAL Planning Part 1, the participant will develop more skills on how to execute learning in MEAL, participatory MEAL and how to develop objectives and indicators. In Module 3, MEAL Planning Part 2, the learner will gather advanced skills in Performance Management Plan, Indicator Performance Tracking Table, Data Flow Map and Summary Evaluation Table. Apply for this course today by visiting our website, www.humanitarianglobal.com for more details.
Ladies and gentlemen, thank you for joining us today. My name is Eric, and thank you for joining our MEAL webinar this morning. And with me, I have two people. I will start with Anthony, who is academic registrar here at Humanitarian Global. Anthony, are you there with us?
Yes, I can hear you, Eric.
Yeah, maybe you can just tell us something small about Humanitarian Global, who they are and what they do.
Okay. Thank you so much, and also to all of our participants who are connecting to our session today. And just to get started, I would like to take you through in a brief way on who we are as a Humanitarian Global Institute, what we do. So we have interacted with you previously, and maybe for our new participants, Humanitarian Global, this is an institute that is based in Nairobi, Kenya. Our main focus has been to work with both humanitarian and development professionals when it comes to capacity building. So we do support learn on the go, where through our platforms, you are able to upskill even as you work in the field, because we have an e-learning system that is going to allow you to proceed with your capacity building and training. So among the key areas that we manage to focus on as an institute, we do manage to focus on training and learning. And this is a broad category that we ensure that we can offer online courses and training programs. We also organize for webinars, like the one that we're going to be having today. We also do organize for training and workshops. And that means if you are out there, you need your team to build capacity on a certain aspect, you can always get in touch with us, and then we're going to organize for a bespoke training for your team. We also do support capacity development and also team building activities for you and your group in that regard. In addition to that, because we work with a pool of experts when it comes to these training areas, you can always reach out to us so that we can organize for a session for you to do some consultation. We can handle your tasks, your professional tasks when it comes to matters to do with the humanitarian and development issues. Thirdly, we ensure that through the platform that we have, we can also share with you in terms of you sharing other stories on the kind of projects that you're doing, so that you can also connect with other humanitarians across the world, and then they're going to learn about your story. Lastly, we do keep you posted with our blogs, and also we have a new segment. This is a discussion forums, and I'll be taking you through in a short while, because we noticed that we cannot tackle everything within the time slot that we have for the session. So that means after the session, we have a platform where I would encourage you to sign up for, so that now we can proceed with the discussions there. So just in a quick way, before I go to that, I would like to mention some of the areas that we managed to cover. And some of these areas include what we're going to focus on today, that is monitoring, evaluation, accountability, and learning, that is MEAL. We also do train on water sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant, and young child nutrition, and some of the other areas which is work in progress in terms of areas to be introduced soon. We're going to be tackling public health. We do have project planning and management, gender-based violence, and we also have these area of data analysis. So that means, for instance, today we're going to be talking about data collection. So we have another segment of data analysis, and this is where we take you through on how to use tools such as SPSS to conduct data analysis. So we also do offer training on that. And also other areas that includes child protection and livelihood support, climate change, and also humanitarian principles and essentials. So those are among the key areas that we tackle. And as we always say, you can always sign up with us for further training in these areas. We do offer different levels of the courses. For instance, when it comes to meal, we do have a certificate level course, which does take a period of 3 months. And you're going to be taken through a series of 3 modules. And then we have a diploma level course, which takes a period of 6 months, and then a postgraduate diploma level course, which would take a period of 12 months. So we always give you that information via email, and you can always reach out to us, and then we guide you further on how you can sign up. Maybe just before I allow the speaker of the day to continue the session, I'd like to just take you through briefly on what I was referring to when it comes to the discussion forum. So as I said, we noticed that the time is a bit a constraint when it comes to this session. So we have a discussion forum where you can always sign up after the session and anytime. And here we have created a meal discussion forum, which you can sign up. So once you sign up, it's very easy. You're going to be asked for your email, your username, your full name, and then a password. And then after your account has been set up, you'll be part of the Humanitarian Global community. So this is a community that we are building so that we can connect with you from different countries, wherever you are at, so that we can continue interacting with you and sharing this kind of information, getting to learn from each other. So that means if you come to the forum after you sign up, you're going to see that we have the meal discussion forum. And once you click on that one, first of all, you have the new members introduction. So make sure that you can introduce yourself in a brief way. Once you click on that topic, there's a reply button here. So just as a quick way, once you sign up, you're going to have that provision of you introducing yourself, where you can mention your name, your organization, and maybe your country, so that we can know where you're connecting from. And then going back to the forum again, you can see a list of topics. Like today we have a topic which is tied to the session of the day. So once you come to this topic, you can now start replying back. So once you sign up, you're going to see there's a reply button, and then you can start posting your question. So that's how we're going to handle the questions that spill past the time that we have for the day. So also, as part of the rules for the session, do not share your personal information. That is your email address, your phone number on the chat section. So data protection is a key aspect that we also need to be focusing on. So the moment you paste your data there, you're exposing it to to the public. So try to treat your data with a high level of confidentiality in terms of how you share the information. So for the chat section, let's maintain the comments in regard to the session, and for the questions, direct them to the Q&A section. So with that said, I would like to invite back Eric, who is going to guide us further on what we have for the day. So thank you so much.
Thank you, Anthony, for taking us through. And our next guest is our key speaker for the day, Winnie. Are you there with us?
Yes. Hi, Eric.
Maybe you can just give us a small introduction, then you may begin the session.
Sure. Thank you so much. Thank you, Eric. Hi, everyone. Thank you for joining today. My name is Winnie Moya. I am a M&E expert, so sometimes we call it meal. I've been in the practice for over 8 years now, and I'm currently a consultant. So I'll be taking you through remote data collection today. So just kindly give me a minute as I share my screen. Yeah, I hope everyone can see it.
Yes, we can see it, Winnie. I think we may proceed.
Great. So this is the agenda for the day. We'll be talking about remote data collection, when it is applicable, some of the challenges, and lastly, the tools that are used. Feel free to drop any questions that you have in the Q&A section, and then we'll have some time to go through that at different intervals. So let's start remote data collection. There are certain circumstances that may lead to remote data collection, and that means that you may not be able to go physically to the location that you're supposed to collect data for, whether it's for a project that you're monitoring or an evaluation that you have to conduct for a certain project. So some of these reasons include conflict. So there are areas, for example, like some parts of Somalia, South Sudan, DRC, Congo, Afghanistan, Ukraine. There are so many examples that means that, but it's high conflict, it's unsafe. And so traveling, especially when you're not based in that part where you want to collect the data, is a little bit problematic. Secondly, there are some epidemics which may come that may cause some lockdowns. So for example, the COVID-19, we all just went through that recently, but there are also some other outbreaks like measles, which may happen in certain areas that need those areas to be contained. And so that means people coming in and out of a certain zone it's restricted, there's restricted movement. And then thirdly, there's issues of remoteness or travel restrictions. So there are some areas which are actually just not accessible completely by this, especially if you're not from that particular country or community, you may have some travel challenges. And then fourthly and lastly, we have budget restrictions. So of course, you understand that in every project, we have budget lines for monitoring and evaluation, which should be actually between, let's say, 2 to about 8% of the project budget. This may not be the actual, and sometimes there are constraints because of certain reasons. When you don't have a certain budget line to make sure that you can travel, and by travel, I mean you have to facilitate travel for the monitoring visits, for the evaluation visits, if there are going to be evaluations in the project. And that travel means, now that those are consultancy lines where you cater for their flights, for their inland transport, for the accommodation, and the now for the project staff catering for maybe their per diem if they're going to different zones that they're not they're not based. So where you have restrictions, that means that you have to use remote data collection. So we'll start with some strategies which you can use for effective remote monitoring systems before we come to now how to conduct it. So firstly, it's important to have a setup and have functional beneficiary accountability systems. By this, I mean that because in areas, for example, the first here we have the conflict zones. So when you already know that the area that you work in is a high conflict area, you can prepare yourself by setting up these accountability systems or mechanisms earlier on in the project, or have them even before the project starts. And so they're applicable to different projects in a country office program. So that means that you are already getting some feedback from the community. That means that you're already getting data, because at the end of the day, what monitoring and evaluation is about is collecting data. What we are looking for is data to turn it into information that we are going to use to improve the project or program. And so this setup should also be, of course, now facilitated by some budget lines, and make sure it's participatory in nature. So when you're setting up these mechanisms, make sure that you are involving the beneficiaries at the ground level. So that means that you are asking them what are the ways which they are comfortable with in giving you feedback. So whether it's going to be what do you call them, like suggestion boxes, or which are placed in certain areas, or they are comfortable coming to the office of a field office, which is in the area that they feel comfortable going one-on-one to have a conversation, or maybe they may pass this information through other authorities. They could be elders, they could be other village members that are respected. There are so many different ways of having this. And then the organization that you work with now should liaise with these other people in the community to get this information. So that is a start point already. And then secondly, you need to engage independent field monitors. So field monitors are also called enumerators or data collectors. These are the same, the terminologies are just because they need to not be biased. So that means that they should not be, either project staff. In some instances, you can decide to use ex-project staff just because they understand the project, but they need to be very independent. They need not to be working, for example, with like a competing organization or even any other organization which may have some presence at the time. It's important to have an interview with these field monitors to understand what they're doing currently, what they're engaged in, because also, as we've mentioned, these areas are also like conflict prone, and this conflict may be inter-ethnic, intercommunal. So it's important to also understand the people who you're engaging with, because remember, these are going to be the representatives of the organizations at the beneficiary level. And so they need to be the beneficiaries need to be able to be comfortable to have a rapport to give them the information that you're collecting. Then thirdly, another strategy that is really helpful is using GPS-enabled cameras or mobile phones and tablets. So GPS is really important, especially when you're doing verifications. So for example, when you have a project that has established a school or a health center or any other structure, and you want to verify that the GPS coordinates or that it is at the place where it was supposed to be built or even rehabilitated, or even another check for GPS is also when you're doing a survey and you want to confirm that these field monitors have actually gone from either to household or from the different villages that you need to collect data. Because remember, the coordinates are going to be different for each place that they collect data. So you can use that to confirm, because there are always instances that a field monitor may do the survey themselves, may fill it up maybe under a tree somewhere, and lie to the people that they have gone from house to house, if it's a household survey, or from one community to another. So you can use this as a verification. So for the cameras, of course, now you can take now the pictures and then they have the GPS coordinates at the bottom. For the tablets and the mobile phones, what happens is when after they collect the data, especially in a survey format, there's an entry at the bottom, which sometimes it's automated, sometimes you have to put in at the actual survey, you put in GPS and then it will pick the coordinates automatically. And then this will be fed up to the server, and then it will be at the point of data analysis where you can now verify. And another strategy that is really important is to use shorter questionnaires that can be conducted online. So what happens when you're doing a face-to-face interview or a survey is that you have a little bit more time to explain, you can have a conversation with this person. And so 1 hour can just pass when we're talking, but when you're doing remote monitoring systems, when you see the different tools, sometimes this remote data collection means that you're calling someone over the phone, and so they may not have 1 hour to answer your questions. So making it shorter, maybe about 20 minutes is usually a good gauge, at most 20 minutes. That enables it to be facilitated much easier on phone or online. So using either like Zoom, this platform that we're using today, you can use Skype, you can use WhatsApp, depending on also now which internet facility is applicable at the time for both the researcher and the respondent. And then next we have conducting field visits to understand challenges. So where you may not be able to collect the data, but you can still travel at some point. Let me give an example of like the COVID-19 pandemic. There was a time that there was completely no travel, especially inter-country. And then in country, there could be some movement. So when you have a few times when the country opens up or when these restrictions open up, it's important to have field visits. You may not collect all the data that you don't need to go with all the key informant guides, the focus group discussions or case studies, but these field visits are important, especially if project staff are going to be there, project staff and monitoring and evaluation staff. So you can hold informal interviews, or you can decide to just have a meeting whereby you understand what exactly has been going on, so that you make sure, even if it's after the data collection, it acts like a verification, and it helps you also, again, help to fine-tune your project in line with what you're receiving, the feedback that you're receiving. And then lastly, tied to this is also ensuring periodic review meetings. So these review meetings can be at site level, or if not practical or not feasible, you can still do them at your head office, which may not be at the location where the data is collected. But the point of this meeting is to still make sure that you understand what is really going on at the field level. So be it challenges, be it lessons learned. These review meetings, remember, they can be quarterly or annual, depending on also the time that the project is. So for example, if you have a 5-year project, it's important to have annual at the very least, but quarterly also help you to be able to maybe make some changes faster than the annual meeting, because the annual meeting, you'll have just 5 meetings, and then you may have so much that you could have done or changed before then, or you can have biannual. So all these are usually set at the beginning of the project, and it's important to foresee some of these challenges, especially if, again, as I've mentioned, if you know that this is a conflict area, you know that you're going to use remote data collection. So it's important to put in these strategies. Okay, I'll move on now to some of the challenges that may be faced when you're doing now this remote data collection. So obviously, as we've mentioned, there's limited contact with staff and beneficiaries because you're not able to go there as the project staff. And that means that you have to assign this independent field monitor who, again, remember, he or she is coming in as a person who does not work there. And so there is no that connection. They don't understand what has been going on previously. And this is going to be, they're just collecting data it's like their first time ever interacting with this project. So this limits your connection, this limits the continual relationship and rapport that you have with the beneficiaries and the local partner staff, especially when you have an international NGO, for example, using a local partner, or even when you have a local partner, but they don't have capacity in some areas, and now they have to use these other remote methods of data collection. So another challenge is enumerator bias. So as I've mentioned, these enumerators or field monitors that we're going to use are independent, and they may come in with their own subjective bias. So one of the biases, for example, there could be many, but 2 that I really want to highlight here is their questioning technique, for example. Remember, yes, you have to train these enumerators or field monitors, but they may not be able to probe as well as you may want, especially for the key informant interviews or even the focus group discussions. They may go through this process very hurriedly, and because they don't understand maybe the impact or the importance of doing this data collection well, they may go through it quite fast because they feel that they just want to accomplish and move on to the next task. They may also have a bias in the sampling. Remember, yes, you will provide them with a guide, but at the end of the day, they are the ones at the field level, at the site level, or on the ground. So that means that they are the ones who ultimately will know if they reach the sample, and they may report something different. So there's always that risk it's important, again, to make sure that this is really emphasized at the training level. And that's why even when you're selecting the enumerators, it's important to get someone who at least has some good level of literacy, and for them to understand the importance of selecting the right sample or population. Because at the end of the day, what we are doing, this data collection is not about the numbers or the quantity of data that we have, but rather the quality. So the minute that you take up the wrong sample, whether it's the wrong sample size or the wrong person, your data is already compromised in terms of quality. Let me give a practical example. So for example, you go to a village and the sample is supposed to pick up vulnerable women. So women who have undergone some form of gender-based violence, because there are quite many. So the samples that you've given them, the enumerators, is to pick out 5. So for example, when you have like a baseline assessment, that's at the start of the project, and you may not have the contacts of these women in this community. So they may not have any mobile phones, you do not know them in person, but you've told these field monitors that go and make sure that you select only the women who have undergone gender-based violence. So they may go into the community and pick out women, but different women maybe who have undergone some different calamity. So they may be marginalized, but they have actually not been marginalized by virtue of gender-based violence. And yet this is a gender-based violence project. So when that happens, remember, you'll still collect data. You may still have those 5 data, but you don't have the quality of data that you get. You may need to go back and collect more data, which is again has implications on your budget. And there's so many other ripple effects. Okay, let me move on to the next challenge. So finding reliable enumerators. Yeah, so as I've mentioned, these enumerators need to have like some minimum qualification, not necessarily in terms of certification, but at least they should be literate, because they will be reading out these questions, these questionnaires, the guides, and they need to be able to actually know how to question someone, to ask someone. So they need to have at least gone through some sort of schooling, whether formal or informal, depending on the area, because sometimes you don't have, it's hard to get literate enumerators, but it's important to at least do those checks. You can even actually do, in my experience, actually, we do just very simple checks. Very simple exams to the trainees, to the monitors. So very short, like it could be even 10 questions, alphanumeric. So just to check if they can read words and numbers. And then from there, you can now rank, because you have a lot of enumerators who may come wanting to work with you. Then you can rank the ones who are scoring the highest. You can select now from there. And then remember, it's also important to have a mix of gender, because you're going to a community which of course has men and women mostly. If you understand maybe the area is predominantly women, or women are the main target for this project, it's important to again have more women. But even when you have more women, because again, understanding these communities where there are low literacy levels, at least have a way of them to understand what the project objective is. So they can even be able to just have a conversation with the respondents or the beneficiaries, and they can just narrate a story. And from there, you can now derive from that maybe the answers to what you require. So it's all about also going to the level of the enumerator for them to understand what you need from them at a point of make it very simple and make the questions very simple and straightforward. Another challenge is limited use of GPS in insecure areas. This is a key challenge, especially now when you have verifications or you're undertaking a lot of observations. So that means that especially for the donor has to understand this, and also the project person especially when you have the local partner is different from the implementing. The implementing partner is different from the partner who has the funds, so the donor-funded organization. So from this, it's very hard to now go about this, because at the same time, these insecure areas, if you cannot take the GPS, it's very hard to take now photos. But there are other ways to go around it, maybe during field visits when it becomes a little bit less hostile. You can be able to do other verification visits, maybe later on in the project. Apart from that, it's just making sure you triangulate the information that you get. So when you, instead of the observation, you can do short interviews with maybe the management committee of the infrastructure or the project staff who have been involved in supporting this rehabilitation or building of this particular item, whether it's a school or a health facility. And then you can still hold focus group discussions with the community to understand, okay, what are the challenges maybe of accessing this area and the functionality. So from there, you can see that it's actually been implemented and what is happening, and maybe the rate of implementation, or what are the gaps. So lastly, limited internet connectivity and also just poor network coverage. This is again in mostly insecure areas and also remote areas. It's a really big factor, especially when it comes to uploading of data when you're using online tools, or if you want to use platforms such as Skype or WhatsApp to call remotely. Maybe you're from the head office or a different office not in the country of implementation. And again, to be able to go through this challenge is to triangulate the information, to use other ways which now need in-house at site level capacity. So that means now engaging the field monitors who are there, or the project staff who are there to undertake the data collection for you. So instead of doing it online from the head office level, you just have someone to take the interviews or focus group discussions. And then from there, like, there are ways to use tools such as Kobo offline. So this can be helpful. If not, you have to, of course, now look at how to maneuver with the budget that is there to ensure there's some movement, whether it's from now that very remote area to a place where there is some network, maybe a field office that is not too far. It could be maybe even 2 hours drive, facilitated by the organization. And then you can have now some field officers undertake now these interviews. So for the communities, for the beneficiaries, you can collect now the data, whether it's in written format, like in note taking, and then this can be typed and transcribed at the point where you have the internet connectivity or better network coverage. But usually, again, as I've said, these are usually foreseen challenges. We always understand areas where there's connectivity and there's no connectivity. And so it's important to just plan properly from the inception point. Okay, I hope that's clear. Then there's some other challenges. Again, there's remote capacity building for staff. This is usually very challenging. I've experienced it myself, and it's it's quite difficult, especially now when you're doing training, this capacity building for field monitors who are now these independent field monitors who have low literacy rates. And then you have the network may not be as efficient as, let's say, right now. So that means that you keep on repeating, even when you send your slides or any guides that you have, you need to ensure that they understand. So you need to make sure that they also ask questions, that it's an interactive platform, that also there's the field staff themselves who may be there physically, may be able to support them, in case of any questions. So it's quite challenging, but usually the ways that you can work around this is now doing like a training of trainers. So you can facilitate training to make sure that the field project staff are very well trained for data collection. But now remember, this is now remote data collection. So they need to give that information to these independent field monitors. And sometimes it means taking even like a whole week of training, could be about 4 or 5 days, could be just half-day trainings or full day, depending on the area, depending on, you know, all these things, that literacy levels. So that's why like doing things like the test at the beginning is important to do it, so that you can gauge the level at which now you're starting on. Because remember, someone who's maybe has finished primary school and one who was a grade 2 dropout, they're on different levels. Maybe their understanding is very different. And then again, they may have a large gap from the time when they left school. So even if they're not applying any form of reading and writing in their day-to-day life, engaging them with very complex materials becomes really hard to make sure that you collect the right data. Okay, and then the next challenge is cost limitations. As I mentioned, we're hiring field enumerators who are now independent of the project, of the organization. That means that you need to employ them for the duration of the data collection, which could be 2 weeks or even 1 month or 1 week even. But even if it's 1 day, you need to ensure that you have facilitated some, you know, monetary compensation for them. In some instances, there are organizations which also have budget lines to give them a snack or water. And then remember also, when they're facilitating some focus group discussions or some interviews, there may be some informal arrangements to make sure that they also compensate, okay, not compensate really, but to ensure that the respondents are comfortable. So just providing them with refreshments maybe after the discussions, or yeah, usually just refreshments or snacks. So this is another cost line for another budget line cost, which you may not really be flexible, but it's important to be very transparent to the donor for them to understand. And then you can decide on your strategy of hiring enumerators. You can decide if it's a 5-year project that, yes, you're going to use independent monitors, but you will use the same monitors. So that reduces, one, the training time. So you don't have to keep on having a 5-day training period for, you know, all the times that you collect data for that 5-year duration. But remember, even this, as much as they're independent, they may get other assignments. And so you may need to recruit others during that time. So it's just being cognizant of these costs. And then also remember, even during the training period, you need to also provide them with some enumeration, depending on now what is agreed upon. And remember, at the end of the day, you know, these people are working for you, they're representing the organization. So you need to make sure that they're also comfortable. They also understand what are the rates. So it's important to also be mindful of that. So you can put that in your budget. Remember that 2% to 8% budget for monitoring and evaluation, that should also capture this. It may not be explicitly written that this is for hiring enumerators, but you have to be mindful that this is one of the things that you require, especially when you're in those conflict areas or areas where you already foresee travel restrictions. And then the other cost limitation that I need to highlight here is call center. There could be others, but these are like the major ones which sometimes are overlooked. So I'll go into call center later, but it's maybe some of you have already interacted with it, but it's when you're using some computer assisted telephone interview. So that means when you're doing a survey, especially a large survey for households, which could be even like 500 or 1,000, you need to have this in place where the enumerators don't go door to door, but rather they do the interviews, the surveys online. So they call up these beneficiaries, and the information is now generated. They answer the questions, and the information will be generated into the server. And now this is now going to be analyzed as a quantitative analysis for the project. So the costs for this are ensuring that, you know, these field monitors have mobile phones. If they don't have mobile phones, you can provide them with the organization mobile phones, and then that they have the data and the airtime, so that they can be able to call these beneficiaries. And remember, now for these large numbers, you have to also, normally you set targets for daily. They can be, they can do maybe even up to 10 calls in a day. So you need to facilitate them, whether at a daily rate or lump sum, depending on now what is your agreement. So those cost limitations really are, they're a big challenge, because we all know, you know, budgets sometimes are not very flexible. Right, so the next challenge is the higher non-response for online methods. Normally, there's a little bit of aberration of people not to give information very willingly or, you know, continually for questionnaires. Remember I mentioned, like, one of the strategies is to make sure these questionnaires are going to be short. So when you have long questionnaires, which take even sometimes 30 minutes, people may say that they don't have 30 minutes. But if you make a very short questionnaire for 10 to 15 minutes, it can have like higher response rates, but it's not guaranteed. You know, there are instances when, for example, you're doing data collection for NGO staff, and we all understand, even some of you here are NGO staff, and we understand that you're busy. You know, you may not have a lot of time to do that feedback. And once you start and then you drop off, it may be very hard to come back and continue. So it's important to remember this as you're still formulating your tools, that there is a risk of non-response. And then lastly, there's the issue of privacy and, you know, confidentiality, data encryption. Anthony just mentioned, even just before this call, that I mean, just before I started my presentation, that, you know, dropping your email address on the chat box is opening you up for, you know, anyone can actually send you an email, and it could be spam, it could be, you know, you don't can come from it. So these are these are some of the challenges. So that means you can't really guarantee. So for example, one of the tools you see go through are like video documentaries, whereby you have a respondent do a video of themselves and submit that as a form of data collection. So, you know, remember out there, this person can send this video through any platform. It could be WhatsApp, it could be Skype, Microsoft Teams. So there's certain, there's certain, do you call them, softwares or programs, which are at least more stringent in security-wise for data than others. And this should be guided by your organization. So you can decide as an organization, you're only going to be using Microsoft Teams for sending information. So that means, remember the other challenge that we had for having internet coverage. So they might be in a place where they cannot access very good internet to upload it into Microsoft Teams, and you need this information. So you tell them, okay, just send to me on WhatsApp. And then by mistake, you know, this data, this information is sent to another number. And, you know, it just opens you up to a lot of unknown risks. And it's hard to really guarantee that. To be honest, there's no foolproof solution for this, you know, unless you're not going to do this data collection online. But the minute that you're online, there's always a risk. It may be small, but remember the risk. The risk is there. It's either high or low. Yeah, I think that's it on challenges. We can now move on to the data collection tools, which I'll be going through. There are 4 main ones, but some have some subcategories. So the first one is online or phone-based interview and focus group discussions. So this is just the same as the normal key informant interview or focus group discussions. The only difference is that it's done online, either through Zoom, Skype, WhatsApp, or over the phone. Just like a normal, you can dial a phone and then you can have the interview there. Then there's, secondly, there's now the mobile phone-based survey. So this is where now you're using a questionnaire. The first one is the call center, which is now normally takes the CATI approach, so computer-assisted telephone interview. Then there's the interactive voice response, the SMS, the short messaging service. Yeah, so these are the three main ones, which I'll go through in detail. And then thirdly, we have the web-based survey. So this is where now you just send someone a link and then they can fill it, and then it automatically just comes to you. You can see how many people have responded and you can see the responses. And then fourthly, we have the video documentary. This list may not be exhaustive, but there are certain types of subgroups of each. But basically, this kind of captures in a nutshell what the main tools for data collection are. So let's get into it. So the first one is the online or the phone-based interviews. As I've mentioned, you can use now various platforms, depending on now, remember one, like your data security measures. Maybe as an organization, you already have certain agreements, maybe with your donor or even, different partners that you have to use certain platforms. So we have those ones, WhatsApp, Zoom, Skype, Teams. And then now we have Survey, CTO, Kobo, and Honor, where you can build the tool as the interview. Usually these are mostly used for surveys, but you can decide to use it for an interview. You can make it now shorter for an interview. Of course, now the interview is shorter than a questionnaire, so you can have up to depending on the questions which you have, depending on how elaborate you want the responses. But now remember, for these interviews, these are going to be open-ended. So that means that there is no A, B, C, D selections, multiple choice. Rather, you're doing an in-depth interview. So you have just, you don't code the questions, but rather you just keep them open-ended. So after you develop them using this like Kobo, you can now launch them using the Kobo app, and you can decide now that is what you're going to use, maybe both for your interviews or your survey. It's a little bit easier, if you use the same, but again, it depends on your agreements in an organization or even in the department. So let's highlight some challenges for this. Now, when you're doing it remotely, it means that you've already formulated the tool and you launch it, and then either you can have the field monitor going to do the data collection themselves, maybe through WhatsApp or this Kobo, or you can have now the person themselves fill in the interview and then send it back to you. But in any of this, you have limited interaction. Remember, as I said, online people have a little bit of some, they're not as open. So you may not get as much information from the participant. So developing that rapport that you need, that relationship, that trust to ensure now this participant really can give you more information is a little bit limited when you use these platforms. And as I've mentioned, of course, now with the data risks, the privacy risk or confidentiality, as much as you may give them the confidentiality clause, at the end of the day, they do know that we are engaging online. So there is a risk of this information landing into the wrong hands. So they may not have complete trust with you, and it's very hard to mend that. But do as much as you can to make sure that they understand what the objective is, because you're there to reassure them that what you're getting is just feedback. And at the end of the day, this project is going to meet X objectives, and they need to get this feedback so that they can improve some gaps or challenges, and at the end of the day, it's going to benefit the community. So it's important to just make sure that the respondent understands that. And in this case, because you're not participating with them, it's important to make sure that it's very clear at the consent form stage. So just before you start the questionnaire, it's important to really elaborate, maybe not very lengthy, but just be very clear, and even provide an email address or a phone number where they can contact you in case of any questions, or maybe in case of any hesitancies or clarifications. That at least helps to build rapport and trust. And at the end of the day, also, the work that you're doing in the community is what is supposed to already build your rapport and trust with, not necessarily this particular beneficiary, but just in the community as a whole. So when you already have that in place, it's a little bit easier to get information from anyone in that community. Right, and then secondly, we have inability to see some visual cues, which now reduces maybe the understanding and probing or appropriate prompting of the respondents. So in the last session, maybe you can access it on YouTube, we talked about data collection methods in general. And one of the key things that I highlighted, especially for the key informant interview and focus group discussions, is when you're facilitating as the project staff, or even when you have an enumerator, it's important to look at the non-verbal cues that read by the respondent. So this means that you're looking at the facial expression. For example, if you ask a question, when you're doing like an in-depth interview where you can go to sensitive questions, you can ask someone, for example, do you understand what are your rights when it comes to receiving water? And so this person may be surprised that they actually have rights when it comes to water. So their face may be, forming like an expression of surprise, but then that may not be highlighted when they answer. They may answer, yes, I know my rights, but you already know. You can take down some notes and write, okay, the person seemed surprised. And so that can help even the person who's doing the analysis to see if there is a trend in the answers that they're giving. Does it really show that they understand what are their rights? And so, yeah, so these nonverbal cues now are lost when it comes to online platforms, especially now when like you can't see the participant's face. So you can decide to do an online interview, but the person's video is off, or even when now it's either on WhatsApp or on Kobo, and you cannot, you can actually not see them filling in the answers. And again, you cannot probe more, you cannot ask them further to explain certain issues that they have brought about. Other challenges are, technological challenges that we mentioned generally about the network, this, network coverage and infrastructure and communication, especially in remote areas or conflict zone areas. And even during, when you have these calamities, sometimes the infrastructure is not as good. So you're not able to have consistent communication. And so you may have a breakup of the interview. You may either decide to continue, you wait to reconnect, or it may drop off and that may be the end. Then some challenges may be receiving airtime or batteries for the phones, or even charging these phones. So basically having the infrastructure to make sure that the equipment that is being used to collect this data, both from the interviewer side and also the interviewee, they may not be completely able to hold the interview for the duration of it. Then there are other costs, for example, of the phone, actually procuring the phone when there are no phones or tablets. So this example for the organization, it may be a challenge to ensure that each enumerator has a phone, could be especially a smartphone for this, because now you're using this online platform. So that means that it's a smartphone that has to be internet enabled. And so these are costs, again, as I mentioned, that need to be highlighted at the budget level. And if you can foresee these costs, it's important to now have them from the beginning of the project. Another challenge is disturbance or noises, especially when you're doing an interview with someone who may be distracted or someone who is in their natural environment, but they may not have the liberty to maybe walk out to a place where there is no interruption. So for example, maybe it's a conflict area and you have this person who is being interviewed and they cannot go to any other place. And so, you have to really make do with what you have, especially when you don't have any earphones or any technology or software which can be able to reduce this noise now when you get either the audio transcripts. So alternatively, it's just to make sure that everything is written down when they're in such a place. If they can take time and do it later, maybe at night or at times when they feel that it's a little bit less noisy, the better. So remember, it's important to understand your respondent and understand what works best for them, especially in terms of timing and when they can be comfortable to give you this feedback if they're not distracted or they're not in their own private place where someone is comfortable and they can be able to even regulate the noises around them. And then lastly, we have now, again, the issue of privacy. That responsibility of privacy is really left on the participant. So for example, if you're interviewing me and I'm in my home, I can be in my home, but remember now I may be living with, my father, my mother, my husband, all these other people who may listen to me when I'm doing the interview and then may perceive something differently. And then this information goes into different people. So I may not necessarily feel that it's completely private even if I'm in my home. But at the end of the day, as I've said, it's important to make sure that the participant understands the reason why you're collecting this data. And so that makes them a little bit more comfortable, so they can even be free to speak and they won't feel any, any form of that they will receive any negative feedback from whoever is in their surrounding when they are communicating the feedback to you. I hope that's clear. We'll move on now to the next one for the mobile phone survey using now the CATI. That's the computer assisted telephone interviews. CATI. So CATI actually can be used in any, there are different platforms that you can use for this computer assisted telephone interview. So you can use even Kobo. So what happens is that you write down your questionnaire through Excel or directly on Kobo. There are other softwares also like Survey, CTO that can be used, and then from there now that the enumerator who now you've trained calls the different beneficiaries or respondents, and then they ask the question by question simultaneously. And when they do the answers, it translates directly into now this, usually it comes as a spreadsheet of now the total calls that have been made and the answers that have been made. And then now that's through the server, and that's what now you analyze. So using now this call center approach, which again, we've mentioned, has some costs implications. There are higher response rates normally as compared to the next two that we'll see, the IVR and the SMS service, because this one you call the person and then you go through all the questions. But in the other two that we shall see, you don't call them necessarily. They have to be the ones to be interactive with it. So they can decide to drop out of maybe now the SMS, maybe it's, press 1 for this, continue, press 2 press 3. So they may decide to drop off after 2 questions or 3 questions. And then now, because of this, because you are engaging the person directly through this computer-assisted interview, you're able to build some sort of rapport, because at the beginning, of course, you have to start with the consent and explaining what you're doing as the interviewer. So this can be done by even the project staff or the M&E staff if you decide not to have the independent field monitors come in. So when you build the rapport, you're able to excuse me, explain the purpose of the study, and then from there you can now again increase now the response rates for each. Thirdly, we have an increased reach for people with lower literacy, because remember now the onus is on the project staff to explain all the questions. And so the respondent's role is only to answer. And usually these are closed-ended interviews or questionnaires. Yeah. So that means that they answer from a certain limited multiple choice. So it can be either yes or no, or 1, 2, 3, 4, or, regardless. Maybe I can ask you, what is your marital status? A, married, B, single, C, divorced, or widowed. So you can only choose one of the 3. So I don't have to rely on you to read the question, but I will read out the question for you, and in a way that you will understand. So for this, there's a potentially less opportunity for errors, because again, you're explaining these questions. And so that means that if the person does not understand, there is room for them to ask, for the person to repeat. And so it's a little bit less errors in terms of accurate completion. So that means that you're actually answering the questions that have been asked. And then again, for these ones, you can use now longer questionnaires or more complex and more sensitive surveys, because it's verbal. You're interacting with the person, and you're able to explain these sensitive topics, but then in a way which even people who have a lower literacy, or even people who have they understand certain languages better, it's a little bit easier to use this particular platform. But on the other hand, we did say that it's costlier, because remember, you have to procure the mobile phones, and then you have to procure the airtime and the data. So it's important to have all this in place beforehand, because you don't want the calls to be dropping, and you need to make sure that even the feedback is being generated at the same time online. Once they finish a questionnaire, it's uploaded automatically and directly onto the server. If you have, of course, the gadget and the data and the airtime. But on the other hand, also, it requires more quality control and training. So quality control comes in where you have to have someone to check, as the data comes in, what is the quality of data. So the quality of data can be checked through various ways, some which I can highlight right now are like the completion. So making sure that all the questions have been answered or asked. Of course, now there is the provision of skipping certain questions which are not relevant, but those which are relevant need to all be asked and answered correctly. So if it's ABCD or 1, 2, 3, 4, those are the answers that have been given. For those ones which are open-ended, which could be few but are important. So for example, you can decide to have the age as open-ended. So the person to type in the age, you need to have constraints so that the person doesn't write 123 years when definitely you cannot be doing an interview with someone who's 123. So maybe that person is 23, or there was an error somewhere. So checking that, and then checking also the time that the enumerator took, because that is usually recorded through this system. From the start to the end, the person on average, you can decide at the pre-test level that the whole interview takes about 10 minutes. So when you see an interviewer took 4 minutes and all the questions have been answered, it's you need to check further, maybe probe further, check even the enumerator, his or her other interviews, check if maybe they speak fast. There are people who naturally speak fast, but you need to make sure that they're in the range that you've actually checked that is feasible to complete this questionnaire. So you need to do more quality control, and then training, of course, from the beginning. You need to make sure that the enumerators understand how to question, how to ask the questions, if there is need to probe, especially where maybe questions are a little bit sensitive, or they may be complex. They need to understand how to explain. So they need to understand also what is the topic of questioning and what are the objectives. So this it takes a little bit more training than the other mobile survey methods. And then lastly on this, we have there's potential for the interviewer bias to be introduced. Of course, this is applicable in every type of data collection, but here, as I've mentioned, the enumerator can decide, they call this person and maybe the call drops off, and then they decide to just answer the questions on their own perception, or they may ask the questions from their own subjective bias for one reason or another. And that's where now you need to ensure that during the training, it's very elaborate, very clear on what is expected of these field monitors or enumerators, as you may call them. And then also making sure now the quality control is quite strict and ongoing. At the same time, when you're collecting the data, continue with the quality control systematically, not waiting for the quality control to be done at the end, because you can be able to nip these things beforehand, especially when it's about interviewer bias or enumerators who are not completing their work, or the questionnaires like consistently. You need to check for the patterns. Once you have, let's say, for example, 3 enumerators and they do about maybe 3 interviews each, you can check what are the trends, check the times, check even the quality of what they write for the open-ended questionnaires, and even their own feedback, because you also need to ask them what they perceive of what they've done so far, to gauge also their understanding if they're actually doing the right thing. Okay, then we'll move on to the interactive voice response. So it's another form of the mobile phone survey. So this one, I can give an example of like many organizations. So for example, like some embassies or even hospitals and other private institutions may have this platform where when you call in a certain number, which is usually, and most of the time it's an easy number or a landline number, you call in and they tell you to press 1 if you want English, press 2 if you want Amharic or French or any other language, then you press, and then the next one is if you would like services to do with X and Y, press this. If you'd like Z and W, press this. And then it goes on and on. So after that, they kind of like have a way to filter out before you have to talk to someone who is a call center person or an agent, or the person who is going to support you. So it's kind of like a filtration system. But there are times when this is used also for data collection. So whereby when, for example, in the health profession or even education, but I can give an example for health, you're getting some feedback from the people who come to a certain hospital or clinic in a certain area, and you want to understand if they feel that they are happy or satisfied with the services that they have received. So you can have this this system which is formed, and then they can be able to, it's very simple, and it's about maybe 5 questions at most of the time. So it doesn't take a long time. And the point of it is to include people who cannot really read and write very well. So they have lower literacy levels, and most of the time it's actually for rural populations or people who are in remote areas who may not even have this digital phone, smartphones. So they can use their mobile phones, or sometimes even these devices, even in a facility, like now the clinic, they can give the feedback there, and then now it collects this feedback, and then for example, if it's a project, or the hospital management can use now that feedback to help improve this facility. So because it's very simple, and it's very, you can have it from the organization point, it has higher response rates. So at the rural level, it's just a matter of the patient pressing on those buttons 1, 2, or 3, and then they can just listen, and they don't need to be prodded. So it's very straightforward. So they have higher responses rather than SMS, but of course, relative to CATI, which we've just mentioned, that has, of course, the higher responses, but that is when it comes to a longer questionnaire again. Also, this IVR, you're able to use different languages, because remember, we've mentioned it's for rural populations. So you can be able to use even, your mother tongue from that area. So the local community language, whether it's, a defined language, but it's something that they can understand, because they don't have to read. Remember, it's going to just narrate what the question is, and then they just have to answer 1 or 2, which is again closed-ended. So very simple. In terms of cost, it's a little bit more expensive than SMS service, but cheaper than CATI, because you have to have this software and put in these questions. You can keep on maybe changing the questions as per the feedback that you need, but also it's important, you still keep them very few, and keep them in the language that is understandable. So you can also decide if they're being kept in health facilities. So how many health facilities you have to procure, the number which is suitable or which is needed, and then keep track of them, making sure that if it's at the facility level, there's someone who is making sure that people also put in this feedback. Then it also now lacks personal touch, because it's not a conversation, it's just this voice that is just reading out these questions, and there's the answers. You do not ask more probing questions. It's also not inclusive for people who have hearing disabilities, because it reads out, it's very clear when it's voicing out, but if you have any disabilities in terms of hearing, it's a little bit difficult. So even some of the elderly people may not really be able to use this type of feedback, survey. And then, as I've mentioned, there's no opportunity for individuals to clarify questions, because it's not interactive. And lastly, individuals may not answer unknown questions. So they may decide, or if they don't understand, they may just skip or just drop out. Again, there's always that risk. But at the end of the day, if you make it very simple and something that is people can answer in a very short time, it has now higher feedback, as I've mentioned. So lastly, from the mobile survey, we have the SMS, the short messaging service, which usually, again, is prompted by organizations that need feedback. So it could be even in form of restaurants. They can tell you to rate your service, maybe the food, or the person who has attended to you. Sometimes even hospitals also, they have the same, but it can also be used as generally as a data collection. Maybe you distributed some non-food items, or even some food. You can ask questions, or was this sufficient, or were you able to receive your cash if maybe cash was what was being distributed, and was it sufficient? Again, now it's important to keep these questions very short, ideally about 5 or 6, because remember also we are limiting the people who can give this feedback to the literate, who can read and understand and give the feedback. So they're appropriate for short surveys which are very quick to implement. They are more inclusive for individuals who are hard of hearing. So that means that people you only need to just read and write down the questions. And then it can be appropriate for some sensitive questions, because remember it's coming to your phone, which is only you who has access, and you're the one to decide if you want to answer. At the same time, you can have it in different languages, as maybe you can decide one of the questions is, are you more comfortable speaking or answering this questionnaire in which format? And then we have it allows individuals to respond at times when it's more convenient for them, because remember now once you start answering is when it continues to the next question. But if you decide to ignore the first question, when you open your SMS, or when you decide to answer the first question, that's when you can start this short survey. And then as actually some research which has been done was that, they're very low response rate, and even for literate population, it's not as, it doesn't invite a lot of participants to give feedback, because remember, it doesn't have that human touch, human interaction. So there's no rapport or trust. You feel that you're just talking to your gadget. So that's one limitation that you have. But if it's in terms of just getting quick feedback, the response rates can be improved. If people know that just do this short survey, or you can even let them know that it's going to be coming at this time, or ask them what time is more convenient for them, and then it can be scheduled to be sent out at that time. And then there's also potential for question break off. So once you decide maybe you've answered 2 questions and you've been distracted, or you've had enough, it's been a long day, you can just break off and not answer all the questions. So that means, again, our data is compromised, because we are not looking for the quantity of data, but rather the quality. But if we don't understand the whole, all the answers from one particular person, we cannot be able to form a story, or understand the challenges or the gaps, and have specific recommendations. As I've mentioned, again, it underrepresents participants with lower literacy levels, because they need to read and then give your feedback or answers. So the other point is that questions need to be highly specific, because there's no opportunity for you to have that clarification, or that feedback and that rapport. So that means that the questions, they should not be long, but they need to be very specific in nature. So if you're asking for feedback for the non-food items that you provided, you need to make sure that you've said expressly, what is this non-food item? You need to ask, did you receive buckets from maybe organization X, or did you receive buckets in the last 2 months? And then the next question can be, how many buckets did you receive? So they need to be very specific, so that you're getting the feedback that you want in that instant, not waiting for other questions, because you only have a certain duration that someone will be focused on their phone to answer a survey. And then the next point is that, navigating a keyboard can be a challenge for older populations, and even people with some form of disability. Could be their hand, maybe they're not functioning very well, or their hand-eye coordination, and they may press something wrong. So it's a risk as well as a challenge. And then lastly, participants may have concerns regarding charges for submitting responses. So some of these SMS platforms, they charge, it could be $1 or, 0 points, half, like a penny or something. But again, it's something very, you need to be cognizant of, because these populations that they may not have that money to spend on just feedback. If it's free, it's important to make sure that it's explicitly written from the first question, so that people can understand, okay, it's just the feedback being sought, and they don't need to top up their airtime. Okay, and then sorry, I think there's one slide which I was missing, but I wanted to just go through the web-based survey, the SurveyMonkey number 3. So from the web-based survey, what happens is that you just you generate a survey, and you put in this a certain link which you can send to the population or your respondents, either through Zoom or Skype, and then after that they can answer. So these surveys can be on SurveyMonkey, for example, or any other platform which has this facility, but remember constraints on data privacy and confidentiality. And then after this survey is generated, so the link is generated, and now it's up to the respondents. So you're putting up the survey on this on whatever platform. So if it's Zoom, this person can decide to copy this link and send it to someone else. So there's that risk of the people who are even answering it are not the right respondents for it. That's one. Secondly, there's the risk of non-response, which is usually very high for this field in, like it's a self filled in survey, because people always have this tendency to postpone to do it, and especially that they have to click on it. If it's maybe they can see a snapshot of it and they can say, okay, maybe it's just 5 questions, I can answer this. But usually these ones have a little bit of a longer questionnaire, maybe about 20 or so questions, but should be straightforward. There's always that hesitancy to answer. So there's high non-response rates, especially compared to the other methods that we've seen, especially compared to the CATI. But again, at the same time, it's usually sometimes the feedback can be very authentic when you have fewer people who are targeted. But what is usually recommended is that you have a larger sample size, so that you have certain, like about maybe 20% only will answer. It's, you have to keep that in mind. So when you're doing a survey, don't only use this web-based survey platform. You can decide if you have some budget, if you don't have budget restrictions, you can decide to use a call center approach. If not, maybe the online or phone-based interview. So again, triangulation using different methods so that you can get more feedback. And then lastly, there's the video documentary, which I think I mentioned that here, because it's remote, it means that the respondent is the one to videotape themselves. So they need to have a device, whether it's a camera, a laptop, or a mobile phone, a smartphone. So that means that's one cost. And you have to understand if the respondent is also they're able to actually do this. So you need to either take them through a small training for them to understand how to do it. Maybe they need to understand how to position the camera, how to record and stop. If they need to do any editing themselves, or they need to just submit it, how to do that, maybe giving them some certain time frames. So, the training and the time of shooting for this particular data collection instrument is a little bit longer than the rest. And then, maybe if you're doing these videos for different respondents and then you need to put them together, that's again longer time to generate this story. So the risks which are there, as we've mentioned, is on data privacy and confidentiality, especially when it comes to video, falling into the hands of people who are not supposed to see it, or even before maybe the end of when you've not generated what the output is supposed to be. It's really hard to limit that, especially when you're not using maybe one particular platform, which is more safe. So when you start using different platforms, it becomes subject to, it's a higher risk that it can fall into different people's hands. And then the other thing is that in terms of clarity and what the output is, what you receive from the respondent can be different based on, again, maybe their background, maybe they don't understand completely how to do the video. And so there may be interruptions, there may be places where you don't hear the audio very clearly, or you don't see visually what is to be shown. It could be an activity, and always from the time when maybe they were doing the project or training, the call center, for example. And so, you need to determine that beforehand. And then the type of survey that you're going to do. So if it's panel, which means that you're going to interview people from different, it's the type of survey or the type of interviews that you're going to develop are going to be for a certain population, either panel or cross-section. So that means that it's a research that is across.
Hello, Winnie. Are you there with us?
Hello?
Yes, Winnie.
You can hear me?
Yes, I can hear you.
Sorry, I think my internet just dropped. Yeah, sorry. Okay, so I was just mentioning on the type of survey. Yes, so the panel or the cross-section. So panel survey is where now you're going to keep on collecting data from the same population. So that means that you can have enumerators who are trained from those areas, and then you can keep on using them. But then cross-section, it means that you may need to recruit the enumerators from different areas. So again, this has cost implications, and also you need to plan which tools are more feasible for the different populations. If maybe they're literate, as per the first bullet point there, if their literacy levels or their gender, age, now that again ties into the type of survey that is going to be used. Then lastly, considering resources on internal capacity or outsourcing. So this applies to field monitors, but at the same time, even if you can subcontract maybe consultants to do this data collection for you, if you have the resources, it could be efficient depending on maybe the area that you're with, and even and the type of consultants who are in the area who have bidded. Maybe they've done similar work, or they have presence in these areas, and they already have trainers. It could be cheaper. It just depends. And of course, this can all be negotiated, and it's important to just pre-plan this. Okay, and then now, lastly, we talk about how to better plan and conduct remote data collection. I think I've mentioned a lot about training. It's very important to train the enumerators or these field monitors how to develop a rapport with participants over the phone. So, for example, when they're doing the training, they need to engage in role play so that they can practice how to do these interviews. And then you need to do a pre-test or a pre-run or piloting of these tools, all of the tools, and they need to ask all of the questions so that they understand how to go through all the questions, if they also understand all the questions, what they're asking. And then this also enables them to time themselves, and also for you to understand how long it will actually take, because you can decide maybe as a native English speaker, I could be faster in conducting a certain interview than someone who is not a native English speaker. So that means that the time allocated is different for each person. So even when you're doing those quality control checks, it's important to keep that in mind. And then you have to also ask that, of course, when you're doing your training and to understand your enumerators better. Then also phone interviews should be shorter than face-to-face interviews. I think I mentioned that you don't have that time to elaborate and you're not face-to-face more, so you're not able to actually engage in a real conversation where you're seeing non-verbal cues and the person is focused on you. When you're doing a phone interview, some people are distracted and they like to keep it short, so it's better to just go straight to the point, and so you have like a shorter questionnaire than face-to-face. And then expect also participant fatigue. Someone can tell you that they've already answered these questions before, or they'll give you more time next time, or someone has come into the room and they need to attend to them. It's important to just be very respectful and tell them at the beginning how much time they need to allocate to you. If now is not a good time, ask them when you can call them back, and then you can slot a timeline, and you need to follow up. If you're not able completely to do an interview with the person, it's important not to keep on pestering. You can always pick someone else from the sample, given that is now, if you're doing the interview yourself, if it's the enumerators, ensure that they understand that you have a certain sample size, and the sample, even when you have names and numbers, it's important to give them that whole list, and then they can pick from a replacement list if the person is not responsive. Yeah, so as I've mentioned on the third bullet point, we've talked about calling them back at different times of the day or the week also. So even when you have maybe some internet problems, there are places where this is scheduled, so they already understand maybe from 1 p.m. to 2 p.m. I don't have internet, so can we talk at 3 p.m.? That should be understandable, and we should also remember to note this down in your report as one of the limitations and challenges that are ongoing in that area, because remember, this also is data that is building up to things like the context analysis, and so we can plan better for next time or even the project implementation. And then for CATI, make sure the phone calls are done at different days at different times, because you can find that if you consistently just do the calls maybe from 9 to 12, you might not be able to get a certain population. Excuse me. So there are people maybe who are always engaged at that time, but if you keep on doing it at different times, you get depending on also the people who you are your population is, you can be able to get a more diverse feedback if you decide to just do a mix of times and different days. And then also remember, some cultural factors such as prayer times and days when people don't do work at all, and it's important to be respectful of that, because you are the representative of the organization, and they may just generalize that this organization is not respectful of my time and they called me at this time, or even hours after work hours when people feel that they cannot give you certain information. So yeah, just schedule the time beforehand, and then you can decide to send an SMS depending on the literacy level, of course, to introduce the study and also to tell them that you're going to call them at this particular hour. And then depending on their response or non-response, now you can decide to call them at the time when you have slotted in. Yeah, so just as I finish up, so next after data collection, you have the data interpretation or analysis, which is usually for remote data collection, it's affected by the response rates that we've talked about with the different methods. and also the selection bias that sometimes is left up to the field monitors. So they may select, the example that I gave was that they may select a sample that is not completely right as per the target population for the project. So this is a high risk, but you need to keep it in mind when you're doing the data interpretation, and so ensure as much as possible to do data triangulation, especially when you're doing an evaluation report. Maybe for the monitoring reports, it's important to keep it in mind, but to also, when you're doing the next monitoring visits, you can apply different methods. Yeah, and then you always have the contextual analysis as these situations are evolving, especially in these conflict areas. You have sometimes it's not as bad as others, so they keep track of the security levels of the different areas when it's about the pandemic or any the illnesses which have an epidemic. It's important to understand maybe which particular population have been affected, maybe where they've been kept, and then if there are like areas where are not completely accessible for outsiders, it's important to keep that in mind and to use that also when you're doing your data triangulation. Yes, and I think that's it from my end, and I think we can go to question and answer session. Thank you.
Monitoring, evaluation, accountability, and learning is an essential subset of project management. The subset has been identified and proven to be critical in the success of 99% of projects. Funding organizations are increasingly seeking more accountability for the funds they provide to development projects. Therefore, without an effective meal system, it would be hard to track progress, discover unplanned effects of programs, make judgments, or determine the impact an undertaken project will have on the target audience. Hence, undertaking this diploma course expertly developed by Humanitarian Global will help you develop advanced skills in this thematic area. These skills are essential in creating a roadmap for implementing project activities as intended. They also aid in conducting monitoring and evaluation activities efficiently and promptly, ensuring continuous learning throughout the project cycle. Among the covered modules and topics include: Module 1. Design logic models. In this first module, the learner gets equipped with hands-on skills on how to create various logic models such as theory of change, results framework, logical framework, and M&E framework. Secondly, meal data collection. In this module, the participant will develop more knowledge and skills on data sources and data quality, quantitative data collection, qualitative data collection, mixed approach, and data management. In the third module, which is meal data handling, the learner gets to develop hands-on skills on how to conduct quantitative data analysis, qualitative data analysis, data visualization, and data interpretation. In the fourth module, which is using meal data information, the participant gets to develop more knowledge and skills on meal communication plan, meal learning plan, adaptive management, and meal reporting. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Thank you, Winnie, for that. And I would like to direct you to the Q&A session. We have a few questions.
Okay, so I can see the question from an anonymous attendees asking, what is the solution for higher non-response for the online methods? I think I've mentioned it's mostly to ensure triangulation. So that means that you're using more than one method. Even when you're calling from using your phone, you can decide to still issue a survey to the same respondents. You can decide to have some follow-up. You can decide to have some follow-ups, maybe using some field visits when it's feasible, and also have some desk review, see what has been done before. You can now use that to more inform your report if you're doing a report. Osman Al-Shajabi is asking, is online data collection reliable? It's reliable, but remember you have to triangulate. That's the best way I could really answer that. But just make sure you have those quality controls, those checks when you're especially doing this data collection using independent field monitors. Then another question from Osman is, will the beneficiary give me the real and accurate information? It's really up to you to make sure that the respondent, the beneficiaries are comfortable enough to give you their real and accurate information. And remember, it's important to trust. So don't impact maybe you, even if you feel that they're not giving you the right information, don't say that just maybe ask the questions in different ways so that they can, when you ask different the same question in different ways, you can be able to see, is this really the real information? When it comes to things that about, maybe if you ask their name and number, that is really personal information. So if you don't get the right name and number from them, that's really it's just the same way if someone asks you, someone who you don't know, a stranger asks you the question of your name and your number, you can decide to just give them the wrong information, but other questions they can answer rightly. Okay, I hope that's clear. Then Lydia Nanono asks, how do you get consent while on a phone call? Do we just ask and then we expect them for yes or no? Do we need to record the phone conversations? Yes, so when you're doing a phone interview, yes, the only way is to just ask them if they consent and they say yes or no. You can record, but you need to tell them that you're going to record the phone call, but you can only record after they say they consent to one, going through the interview, and two, the recording. If they don't consent to the recording, that's okay. You've already recorded that they've said yes to the interview and they will still give you the answers. And at the end of the day, it's up to you to really keep their name and their information, their sensitive information, confidential. Okay, I hope that's clear. And then Angela Mwale asks, can you use all the remote data collection tools to collect results at all levels, input, output, and outcome? If not, kindly clarify what level of results can you use these tools? Yes, you can use them for all levels. Remember now the tools, it's up to the project staff to really, you have to customize to now what level. So like input level is activity level, right? So you're asking questions like, did you receive buckets? And then when it comes to output, you ask questions such as, how did this buckets help you and your household? And then outcome level, you can ask questions such as, what particular inputs did you require from the project that can help you have better hygiene? So you see, it's just the way you ask the questions. But remember, these tools are very general. These are interviews or surveys. So even when you're doing face-to-face, they're just the same. You just need to customize them. Okay, and then Chol Mading Parok asks, how about in a remote context where people are illiterate, have no mobile phones, and insecurity is high, no TPM providers? How applicable is RDC, this remote data collection? Okay, so where people are illiterate and there are no mobile phones and the insecurity is high, there has to be a way to reach them, maybe not through third-party monitors, but you can use the field monitors who I've talked about. The field monitors are usually local community members. I didn't mention that, sorry about that. So when you're having the field monitors, you recruit them from the local community because they're the ones who understand the context, and they're the only ones who can actually navigate through the area. Because remember, you're an outsider in this case. You may belong to that country or regional community, but you're not based there. So those local enumerators are able to navigate without being asked any questions, and they don't look that they're from outside. So they understand maybe the literacy levels, they are able to ask the questions. When you have illiterate respondents or beneficiaries, you have to have the enumerators who are the ones to ask the questions and to clearly ask if it's sensitive questions. They have to know how to ask them, and then they record the answers. So they don't have to use mobile phones for that. They can just use a paper and a pen. When now the insecurity is high, of course, now you have to weigh, like, are they actually able to go to, depending on now your sample and the population, where are they able to go to? If nothing completely can continue, it's about communication from the lower level to the higher level, because the contextual analysis that I mentioned is really important for you to understand what can be done. If completely nothing, no data collection can be done, you can always rely on desk review. So you can look at what other reports have reported, like on the same context. Maybe if it's been an ongoing conflict, what has been done before? So maybe you can apply those lessons. Okay, then there's a question from another anonymous attendee asking which tool is the safest and secure for remote data collection. There's no one safest and secure remote data collection method when you're especially using online platforms. So that means that the data is really, it's out there. You're already vulnerable, and you've already given yourself a risk by putting your information out there. So I can't really answer to one particular method. It's up to you and your enumerators and the project staff and the organization to decide, if they're going to use this because of certain restrictions and they're able to make sure that their data is not compromised, you can go with that particular method. So there's, a lot of research that is ongoing. You have a lot of, like, WhatsApp always increases their encryption and all this data security. But at the end of the day, it's really up to the project staff if they feel comfortable, if they can be able to even access these methods. Okay, and then Maman Sanda is asking, can you share examples on how to triangulate, please? Okay, so triangulation is when you use more than one method of data collection. So remember, at the essence, we have two main data collection methods: primary data collection and secondary data collection. Primary data collection is when you actually go to the field, you or a representative of your organization goes to collect the data in the field. So this can be in person or remote data collection. Secondary data collection is the desk review or document review that you do for data that has already been collected, and then it's in different forms. So it can be in form of reports, it can be in form of minutes, it can be in form of training workshop details, manuals, so many other, but it's in written format. So triangulation is when you mix these two. It can be, you can mix the primary and the secondary, or you can mix, when you don't have maybe secondary, you can mix different primary data collection methods. You're using them simultaneously. So what happens is, most of the time, there's always some secondary data collection, even if you're doing a baseline. Because remember, this community is not a new community. This community has been in existence. Unless completely, like, sometimes it's a little bit hard, or you have time constraints that you don't receive. You don't get the data before the time that is supposed to be used, but there's some information somewhere out there. So it's all about research. So when you triangulate, you just make sure that you use like an interview, and then you also use like focus groups or a survey. This could be just short interviews, or short interviews or short surveys, and then make sure you see these answers correlating to each other. So that means that you're not going to the same population and giving them all these different tools. No, it's the same community, same population, but not the same respondent. it's a different respondent, but remember, if they're facing the same challenges, it means the information needs to kind of be similar. So when I go to community X, the elder, the local authority, the pregnant woman, and the young boy need to tell me a story which is somehow similar. They may have a little bit of differences in that maybe my challenges as the pregnant woman are a little bit more diverse than the elder. But at the end of the day, when we ask things about maybe the general support that they've received, the story needs to be the same. So that is what triangulation is. I hope it's a little bit clearer. Okay, great. I've seen your message clear. Okay. Okay.
Winnie,
Yes,
can you hear me?
Eric. Yes.
Maybe we can take the last two questions so that we can allow our participants to also talk to us. So maybe the last two questions due to time, kindly.
Sure.
Thank you.
Let's see. Okay, I'm checking the Q&A. So Abdallah Jama is asking, what type of quality control methods should I use to conduct such remote or online data collection approaches? Okay, I mentioned a few quality control measures for the CACHI particularly, but this can be applied generally. So let me just go through that again. So it's on the enumerator. This is when you're using especially the field monitor or the enumerator who is independent. So that means that you're checking the feedback from this person. And what you can check is you have, when you're starting the data collection, you kind of need to put like a target to each enumerator to have a certain number of interviews that are done per day feasibly after understanding the context. So whether it's a survey or an interview or focus group discussions, you need to check if one, they've been able to do those, the set number to completion. If possible, they need to send through the notes or the transcripts on a daily basis, or even as they continue, if possible, because from there is where now you can check the quality of their outputs. So you need to check if they've asked all the questions, if all the questions have been answered, and then you need to check for like the survey where you use the computer-assisted telephone interview, the CATI or the call center, you're able to actually see the start time and the end time. So that means you can calculate how much time is taken by the enumerator per interview, per questionnaire or per survey or per respondent. So that means that you can check, are they actually allocating the time that they need that is sufficient for each person. So if it's if you had done the pretest or the pilot and you saw that 10 minutes is sufficient to finish one, and there's an enumerator taking 3 minutes, you need to flag that and then check if his other responses are also 3 minutes, or there are some which are 12 minutes. You need to check that, and even if you're able to contact the person, or if you have a supervisor on the ground, make sure that they talk to them. The earlier the better. So that's why we really stress for maybe daily checking for this the feedback. So check on completeness, check on the quality of the output, and also check where it's open-ended, if they're actually answering as per the question, and the coherence of the answer. Maybe the English does not have to be perfect, or the whatever language that you're using does not have to be perfect, but it needs to be coherent and understandable. Okay, let me just answer the last question really fast. Then, so Albert Dotze asking, please, using local people to collect data, please, using local data to collect data compared to trained staff, which one reduces ethical issues in data collection? The local people that you're using should be trained. So even if they're not staff, so these field monitors, they should be trained, and they need to have been taken through the prerequisite training. So for example, some organizations need to take them through like child safeguarding protocols. So this reduces any issues. About ethical issues, at the end of the day, you need to have gotten the authority And before you actually start the data collection, the go ahead needs to come at an earlier level. So yeah, I think that's what I can say to that. I hope that's clear. Yeah, I can say we don't have a lot of time. Maybe the rest of the questions, I'll answer some as we continue before we end, and the rest can be put in the platform that is being shared right now. Okay, thank you so much.
Thank you for that, Winnie, and thank you for taking us through and answering the questions. And at this time, we'd like to invite a few of our participants just to answer questions. So for you to do that, you can kindly raise your hand on Zoom, and I will be able to get you your name, and I will give you a chance to ask your question to our key speaker for the day, who is Winnie. I will start with
Yes. Thank you. So can you hear me?
Yes, we can hear you, Mohammed.
All right. Thank you. First, I would like to thank Winnie for the great presentation, and also the Humanitarian Global for this great webinar. Let me go my question directly, and I would like to ask Winnie. So my name is Mahmoud from Somalia, head of research programs at Sears Institute. Actually, data collection is the major challenge usually faced when doing research or any assessment. Particularly, for example, like I would like to ask Winnie, when we are involved in data collection, let's say that we would like to assess in the project evaluation. So, for instance, let's say that the project was targeting the beneficiaries through a cash transfer, and we would like to know the impact of the program. So when we doing data collection from the beneficiaries, we ask, was the project brought any impact, or do you access to any diversified food or any impact? So in this case, actually, they think that if they tell the reality, they may not receive future support or future aid. So they will always keep saying, no, we are still the same. The cash transfer was inadequate. It was not enough to address all the basic needs or so on. So in this case, we need to come up, or we need to look for strategies to obtain the true answers. So what do you think, a best strategy to train the enumeratories to obtain or to gather the most, accurate information from the beneficiaries? Thank you.
Thanks, Mohammed, for that question. And I understand the challenges that are there. So, okay, firstly, before we get to the enumerators, it's important for the project to always give a clear picture of what they're doing when they're doing the project implementation, because this sets the precedence of the community wanting more, or demanding more, really. So it's for the community to understand what you're doing. If, for example, you're distributing non-food items, or you're supporting hygiene promotion and other activities, they need to understand that those are the only elements that you are doing, and they don't need to be told, like, because of the donor constraints and all that, but they just need to understand the scope of the work that is done, because this makes it a little bit easier for the enumerators when they come to ask the questions, whether it's at monitoring stage or at evaluation stage, that they're only asking these questions because this is what was to be supplied, or this is the support that they were supposed to receive. So in terms of training the enumerators, I think it's especially when you're using independent field monitors or enumerators from the area who are not project staff, it's important to, at least at the first time that you're using them, to take them through a really comprehensive training, which includes both understanding of the different collection methods, but also of the project itself. So they need to understand, what was being done, when it was done, so that they should even be able to gauge the kind of answers and responses that should be coming up from the community. That being said, again, as I've mentioned before, triangulation is really important for you to really understand and see the true picture of what is happening on the ground, because it's not everyone who necessarily may give this inauthentic feedback. But if you ask questions to people at different levels, so for example, even in your targeting, you need to be very purposive. So you can decide to question the project manager, the donor manager, and the donor. You can ask if you have a local implementing partner. If you can talk to the authority. So ask people at different levels, and then at the community level, you can ask an elder, different profiles. So a woman from maybe the community, a woman, a youth. Gender is very important, and age. So when you get the feedback from these people, you can decide to use either focus group discussions or interviews for each of these. The feedback that you get should be able to align to a similar story. So they can't all be just saying, we want more, because it's also about how you're asking your questions. The questions should be open-ended and understanding them, not necessarily telling them that this is what is happening. You're seeking feedback. And then the first point that I talked about in the strategies for a remote data collection system is ensuring that you have a beneficiary accountability system. So that means that you're already getting some feedback on the ground, especially for long-term projects. You need to be able to consistently gather feedback in a way that is participatory and in a way that the community really actually feels safe and comfortable to share information with. I hope that's helpful, Mohammed.
Clicks Miller, are you there with us?
I am there. Can you get me?
Yes, I can hear you loud and clear.
All right. Thank you, Mr. Eric. Thanks, Ms. Winnie, for the presentation. I just wish to find out, is it possible for us to collect data both online and offline? That is maybe through phone calls, SMSs and surveys, and using Google Forms. And at the end, we effectively aggregate the data together. This we are considering the fact you earlier said we should also consider some people might be in remote areas, network challenges, comprehensions. And if we are in some particular localities where we have these challenges that are disproportionate, is it advised that we should collect data both offline, online, or through phones? And if so, are there possibilities for us to effectively aggregate this data together? Thank you, and over.
Thanks, Clicks Miller, for your question. Yes, it's possible to use the different methods at the same time, but then one risk that you have is that you need a lot of time for the data analysis for you to be able to do it well. Because as I keep on emphasizing, is about the quality of data, is not the quantity that matters. So you need to, the tools that you select you're selecting them because of a certain purpose, because the reason why you're using different tools, not just one tool, is because maybe some can be able to get to some people of a different gender or stature in the community, and others cannot, or maybe the literacy levels are different. But so you need to know the why. First of all, you're using the different data collection tools, and then remember also the time that you may use. Even when it's remote data collection, remember it's still time consuming, because you need to set up the interview time. People may decide to postpone it. then you need the time to actually collect the data. You take your notes, transcribe if it's audio tapes, and then when you actually now come to the analysis, when you're using the different forms of data collection, as I've been mentioning on the triangulation, it's going to be a better outlook, a better report, but it's usually best to allocate enough time. I can't give you like a measure of how many, because it depends on your staff. It depends how many staff you have in your office who are going to do the data analysis and even the data collection. So because some instances in some organizations, you can decide to, because you have capacity, you can decide to start the data analysis as the data collection is ongoing. So for example, if you have data collection for 3 weeks, you can decide on the second week, you already start the data analysis for what has already been completed. I hope that's clear.
Yes, it's clear. Thank you so much.
Thank you, Winnie, and thank you, Flex Miller. I can see we have patience. As we wait for Lamin, we have Kasaga Philip. Philip, are you there with us?
Yes, I'm here, Eric.
Yeah, thank you for joining us, and you may proceed to ask your question.
Thank you, Eric, for the organization of this this training, and thank you, Winnie, for the presentation. My name is Philip Kasaga from Uganda. I work with an organization called Hope After Rape.
Monitoring and evaluation have been considered to be an essential component of project management. As project management continues to evolve, there is need to incorporate stakeholder participation, information sharing, learning, accountability and organizational transparency. To address the inadequacies of the previous M&E framework, Meal Course has been developed to incorporate these accountability and learning aspects. Undertaking a postgraduate diploma in Meal prepared by Humanitarian Global will help the learner develop an in-depth knowledge and understanding of evaluation designs. In this module, you will get to learn more about experimental design, quasi-experimental design, non-experimental designs and comparison matrix. Secondly, evaluation approaches. The second module aims at covering various evaluation approaches such as feminist evaluation, transformative evaluation, real-world evaluation and realist evaluation, equity-focused evaluation and developmental approach to evaluation. Thirdly, preparing for an evaluation. The third module details all the steps involved in preparation for an evaluation by helping the learner to understand the initial steps, construction of theory of change, development of results chain and specification of questions. Also, you learn more about impact evaluation. In this fourth module, get to learn more about evidence-based policymaking, what impact evaluation is, prospective against retrospective impact evaluation and efficacy studies and effectiveness studies, deciding whether to carry out an impact evaluation. In addition, you will learn about causal inference and counterfactuals. In this module, the learner will get to study more about causal inference, the counterfactual, estimating the counterfactual, and 2 counterfeit estimates of the counterfactual. Our sixth module is instrumental variable. This module offers more understanding on how to evaluate programs when there is no compliance, types of impact estimates, imperfect compliance and the randomized promotion as an instrumental variable. The seventh module covers the difference in differences. This module will focus on teaching the participant on how to evaluate a program when the rule of assignment is less clear, the difference in difference method and how helpful it is, as well as understanding its limitations. Lastly, you learn about matching. In this final module, you will get to learn more about constructing an artificial comparison group, propensity score matching, combining matching with other methods, and limitations of the matching method. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.